rehab programs for doctors. So think about that. Whether it's for mental or physical reasons, going to go see a doctor in those professions, those doctors suffer from mental issues too. It's not just the patients that they treat. Psychologists and all that, a lot of them are alcoholics, let alone they deal with other forms of recreational drug use, right? But it goes unheard of because you're focused on getting yourself right by dealing with them, thinking that they're supposed to help you, but then they have an addiction just like you. Let's go ahead and tune in with CBS Mornings for this clip to see more about it.
How are you?
In the medical world, it's the patient's problems that generally command attention.
In your case, you had a very favorable tumor.
But for surgeon Courtney Barrows McEwen, a problem with alcohol dates back to at least her time as a star medical student.
In my mind, I was still I was successful, so like, how is this a problem?
Yeah.
Based on that picture, I could tell that was at least 2 decades ago. Not that that means anything, but, well, it does, because that means 20 years of substance abuse, alcohol, whatever she was doing. It's like they said it was for alcohol, but you never know. It might be a few more things, but it doesn't seem to really affect her work, or does it? I mean, some people need to be on these drugs to keep being the top doctor. As sad as it sounds, but hey, I mean, something has to keep you ticking and going, right? It's like a lot of these people in the medical field, they like to drink, believe it or not. Especially nurses, they love going to happy hour in between shifts or after shifts.
But then, of course, it did become a problem later on.
Eventually, in fact, it landed her in the hospital.
Ooh.
She was only allowed to continue practicing medicine and take on a prestigious surgery fellowship in Ohio if she quit drinking entirely.
You're supposed to be having zero.
Oh, 100, yes, 100%. Zero mind-altering substances.
And your career is on the line if you relapse.
Yes.
Which is exactly what happened. Though never drunk on the job, she says, test results that arrived while performing surgery back in 2021 revealed near daily drinking.
Whoa.
Your values go out the window and your judgment goes out the window, and it's all about just feeling better. And to me, that was the only way I knew how to make myself feel better.
When you get caught, how does it feel?
And I just remember thinking in my mind, well, I better enjoy the rest of this case because I think it's going to be the last case I ever do.
But it was not, it turned out, the end of her career, as she was offered one last chance to get sober.
Physicians get sick like everybody else. They don't have any special protection or immunity from illness. They're special.
Dr. Chris Bundy is Chief Medical Officer for the Federation of State Physician Health Programs, which since the 1970s has been quietly working in nearly all 50 states to treat doctors diagnosed as substance abusers.
Why is it?
It's like our thing is we figure if they do have some kind of abuse disorder, whatever they like to do for recreation outside of the doctor's office, a lot of times you would think it's minimal, right? It's not affecting their work, but you'll be surprised. Like on their off days, especially if they don't have a lot of family around, let's say you're single, so you figure you can do whatever you want on your off days, but then it's not always alcohol and drugs. There's other addictions too. There's gambling, casinos, strip clubs, whatever you could think of. That's a disruption. It's like everybody needs a distraction every now and then. It's like we can't just focus on work 24/7. I mean, that'll just drive you to an early grave, right? So we look for escape routes, entertainment venues. That's why there's concerts, ball games, and all that. And it's like whatever you choose to do, you pick your poison. It's going to cost you money regardless. But luckily, these people have the money to spend on these addictions. I mean, addictions can get costly, but some people don't care because they have the money.
The culture of silence a problem in the medical community?
Because the culture of silence means that doctors can get sick and bad things can happen to patients.
Right now, Bundy says there are more than 6,000 doctors across all fields of medicine licensed to see patients while also in treatment for their own addictions. And for anyone who might be troubled by that,
What do you say to those people?
I'd say a monitored physician is a safe doctor. If I walked into the doctor's office and it was one of my program participants,
But the downfall about that is it's contradicting. How are you telling me as a patient to stop doing something when you're doing something similar to what I'm doing? It doesn't make any sense.
breathe a sigh of relief.
Really?
Yeah, I would.
It may be one of the most successful rehab programs ever devised. According to one study, fewer than 20% of doctors who completed the program were found to have relapsed after 5 years, while relapse rates among the general public can be as high as 60%.
So it was a waste of time then. The relapse rate for patients is 40 to 60%, but for doctors is 19%. I wonder why. Because they realize that all that hard work to get through medical school is in jeopardy. Like, what's the deal here? Versus regular people with regular jobs, regular population, whatever's going on outside the job at home, they're going to resort back to maybe something else. Maybe they'll choose a new addiction. Maybe they'll stop using crack and go to alcohol. Or maybe they'll start gambling.
What is the secret to it? Why is it so much more effective than what the general population gets?
I think it's the comprehensiveness of it. So there's that wraparound chronic illness, chronic disease management model combined with the accountability of the program.
What you're describing sounds like something that should be available to everybody. Why isn't it?
Well, it's resource intensive.
And keep in mind, these people with these high title positions, a lot of them are married. So that's another reason why a lot of them go in here with addiction and everything, because they have a stressful career and then they have to go home to their household and deal with more stress. So that's stress on top of stress. So to get away from it, you go to the bar by yourself and just sit at the, front, have a few drinks, watch some sports, have about 3 or 4 drinks. And then maybe after that, hit up a massage parlor or strip club and just have a good time. VIP section, get it your way.
What I just described to you doesn't come easy and it doesn't come inexpensively.
But the results have inspired other professions, including pilots, who we profiled in a 2017 story on CBS Sunday Morning.
So if not for the program, safe to say you wouldn't be a pilot today?
If it's not for the program, I certainly wouldn't be a pilot. But more importantly, I don't know if I'd be alive.
Ooh.
Which brings us back to McEwen, one of the few working doctors to ever talk publicly about her treatment.
So if not for the Physicians Health Program, where would you be today?
And you can't really judge the doctors by how they look if they have an addiction or not. Like I said, if they look tired or sleepy, a lot of times it's stress. Their addictions are not going to really show unless they're just completely malnutritioned and not eating, right? So this doctor right here, she doesn't look like she has any kind of addiction, right? It's like she has all her teeth, her eyes don't look crazy, she has her hair. So she looks pretty healthy for a middle-aged person, right? I mean, you're going to see wrinkles. That comes with, age. But in general, it's like you just never know. So when you switch doctors or you had a doctor for a long time, you don't know how long they had an addiction for if they have one. Something to think about, right? So now I think different about these people. They're helping the general public, but are they helping themselves? Because a lot of times their addictions will go longer than the general public's. But for some reason, they won't let it get so bad to where they end up losing their jobs and their licenses. Anyway, this is Kai LaVeo. You could click the link below to watch the rest of the video. I try to keep the videos around 10 minutes. But anyway, I'll catch you in the next video. Good night.